Minoxidil. How does it work to regrow your hair? We've all heard of Minoxidil or Rogaine, but how does it actually work? Well, to start off, I'm going to tell you a little bit about Minoxidil. Minoxidil was first described in the 1980s as a blood pressure medication because it dilates your blood vessels, making them a little bit wider to reduce the blood pressure. So in order to understand how Minoxidil actually works, what we have to do is take a look at the basic anatomy of the follicular unit, and we need to understand these cycles of hair growth. If you take a look at the basic anatomy, what we see over here is a follicular unit, which inside it has two hairs that come out of the skin. The bulge region, which is the area of stem cells, very, very important part. The bulb, which is the root of the hair, and the dermal papillae, which is pretty much the blood supply of the hair follicle. Then if you take a look at the cycles of hair growth, we have the anagen phase, which is the growth phase, typically between 2 to 6 years about. In Asians, a little bit longer. Telogen phase, where it is the resting phase of the hairs, that's where the hair starts to go to sleep. And the exogen phase, where the hair actually falls out. The telogen phase lasts about 3 to 6 months. The exogen phase is a couple of weeks. What's most important is the anagen and the telogen phase for how Minoxidil actually works. So the actual mechanism of how Minoxidil actually works is not yet completely understood, but this is what we do know. We know that it increases the duration of the anagen phase. That means your hairs will grow thicker and longer. A lot of people who have hair loss cannot grow their hairs very long, and they have sparse, very, very thin hairs that don't grow long over time. It also reduces the duration of the telogen phase, meaning that your hair cycles will grow in a lot faster. It also is a potent vasodilator. That means it's going to bring more blood supply to the area, meaning more oxygen and nutrients to the hair follicle itself. And it induces something called vascular endothelial growth factor. That means that more blood vessels will grow around the hair follicle and means that there will be a better blood supply to the actual hair follicle. Now, this is what you need to remember. Minoxidil is only a stimulator of hair growth. That means it's not going to target the root cause of your hair loss. It's something that is very good to be used in conjunction with another treatment that prevents the root cause of your hair loss. So if you have androgenetic alopecia, you need to be on a DHT blocker plus a stimulator therapy like Minoxidil. It's also important to note that Minoxidil is a therapy that needs to be used every day, if not twice a day. So it can be quite cumbersome. You need to be very, very good with putting it on. Otherwise, you can actually have hair shedding, which is the opposite of what we actually want. This is why I often recommend my patients to start on oral Minoxidil, because just like myself, I find it quite cumbersome to use every day. So it's much easier to take a tablet than applying it on your head, which can be a little bit of a pain in the ass and can cause some itching of the scalp. If you want to know more about oral Minoxidil, we'll do another video on that. I want to know your experience with oral Minoxidil versus topical Minoxidil. Tell me which one you find is better. And in the next video, we're going to talk about those patients who don't actually respond to topical Minoxidil and why they respond better to oral Minoxidil. So stay tuned.